afternoon, President Bill, incoming President Maryland, and to my fellow Rotarians. I have the distinct honor and pleasure of introducing the Director of Gun Violence Prevention for the District of Columbia, Linda Harllee Harper. Our Rotary Club is here today. It's right in Washington, D.C. We're in the middle of everything national and international. But sometimes we need to know what's going on within our own community, within our own city. I have the honor of knowing and Director Harper. We have been acquaintances. We worked together briefly. We've been colleagues. And if I remember correctly, Linda, we went to school together. And don't anybody look at me because you said I was like, wow, you're 40 years older than us. But yeah, we did. That's another story. When it came time to appoint someone for this position, the mayor looked to Director Harper. When I asked Director Harper, I asked her, what would she like the club to know about her briefly? Because as you all know, I would not be able to read her biography with all that one. I couldn't read it anyway. And she said, well, what she would like for the club to know about her is that she's married. She has a teenage child with all that goes with having a teenage child. She lives in Ward 4, and she's a Washington, D.C. resident. Coincidentally, Linda, by the way, my category with the Rotary Club is gun violence prevention. One quick story before I introduce Linda, I gotta know about her. Linda worked at Department University, QRS, and she was a director there for a minute. And there was some issues going on with QRS, which you had to be inside to know the issues. And I happen to be there as well, so I know about the issues as well. Linda left, and of course I left. Well, Linda came, and it was really a terrible shit. Linda came back to DYS. She became the assistant director of DYS. And now that department, through Linda's direction, is now one of the most respected youth agencies in the United States of America, with people asking recommendations from them. And so without further ado, I would like to introduce to our club, Director Linda Harllee Harper.
I'm honored. I'm so honored that when Mr. Barnes sent me an email and asked if I would speak, I was like, wow, I'm very honored to meet with this group. I certainly do presentations all the time, but this was an out of the ordinary request, and I was really honored to be able to present for you today. I have been the Gun Violence Prevention Director for the city since February of 2021. So the mayor declared gun violence as an emergency at that time, and we launched a emergency operations center for gun violence in the city. And the EOC is what it's called, has been up and running since that time. An EOC is an emergency management tool that was used during COVID to bring together a whole of government approach to a crisis. And the mayor saw how it worked well for COVID and wanted to try to put that same approach towards gun violence, because we know that it is going to take all of us to address the gun violence that's going on in our city. But not just in our city, across the country. The gun violence is at epidemic rates, and you can read about it and hear about it all across the news. And it traumatizes each and every one of us, whether you are experience it firsthand or not. When you wake up and hear about a baby being shot, there's no way that you can hear such horrible news and not be impacted by it. And so it's affecting all parts of our community. We had a shooting last night in Georgetown. In our communities that there are communities that have always had gun violence, but now it is absolutely being seen in communities across the city. And so we are working very, very hard to try to pull together and coordinate the resources that can go towards helping to address this issue. So this is a pretty lengthy slide deck. So some of these slides I'm going to go right through because I absolutely want to make sure that I have time for questions at the end. So this is the overview. I've already shared with you that we were launched on February 17th. An emergency operations center model this is the first in the country to ever be used to address gun violence. And so it pulls together all of the district agencies and nonprofit partners and community-led efforts focused on the same topic. In February, the mayor launched with a $15 million investment to get things started. And now we have a $59 million investment for FY22, which includes funding to support returning citizens and to hire additional violence interrupters who are in our communities. We did a grants program already in FY21 that was $750,000 that allowed for residents who had ideas about things that they could do in their community to impact public safety. It allowed them to apply for the grants with minimal roadblocks. But there was also larger grants of $50,000 for established nonprofit organizations. For FY22, those grants will be doubled. The grants were extremely successful, and we're going through the reports now, and we'll be rolling out another round of grants in the next couple of months. It also allows for safety and aesthetic enhancements in wards 5 and 7. So public safety has environmental factors that go along with it. And so it requires a place-based approach as well as a person-based approach to gun violence prevention. And so, for example, additional lighting in particular communities or ways to repair fences that may be used as an access to bad activity are ways that there can be enhancements made to the infrastructure in a community while impacting public safety, and working very, very hard to generate jobs for people at risk. The mayor has committed 110 DC government jobs with the Department of Public Works for persons who have been perpetrators of gun violence or victims of gun violence. And she has challenged me to generate meet and or exceed the 110 jobs through the private industries. So working very hard to do that. The mission of Building Blocks is to create sustained reductions in gun violence in the District of Columbia by supporting the people and the places most likely to experience gun violence using a collaborative whole community public health approach. In 2020, there were 158 people who were victims of homicide by gun. Compared to 2019, these numbers represent a 26% increase in shooting incidents involving a victim and a 33% increase in the number of gunshot victims. So we know that there's surface level issues, things that are happening in our communities. I describe it as people have very short fuses right now. And during COVID and coming out of COVID, there are stories and incidents that are beyond understanding of things that escalate very, very quickly and end in someone using a gun. We know that we have feuding communities in the district that sometimes are retaliatory in nature that result in the loss of life and gun violence. And we also know that social media and rap music disputes fuel the back and forth between the different communities. We know that there's a poor emotional regulation and greater impulse. I talked about that earlier. And we know that robberies gone wrong can often turn violent. Also, we've seen domestic violence cases that have increased and ended with a gun, including the availability of guns just overall. To put that in perspective, MPD has seized more than 1,500 guns already in this calendar year. And we are nowhere near putting even a dent in the guns. The firepower that enters into the District of Columbia is absolutely astounding, especially because we have some of the toughest gun laws in the country. And so it is really an issue. And they are not just handguns. We are talking about weapons that are used for warfare. And it is very, very scary to see how quickly and at such high levels they're able to enter into the district. So across the country, many folks are studying the why. What is going on? Why are so many people shooting now? And why are we having gun violence? And so there's a lot of studies being done about how COVID-19 tied into the increase in gun violence. And so there's a lot of different theories that probably will be talked about for years to come. But definitely the economic downturn combined with the race-related unrest certainly fuels it, along with people being the shutdown of the country and the fact that there were so many persons who were, COVID showed us a lot of things, but there are a lot of people who are residing in homes that are not healthy and safe. And so being confined to your home raised a lot of emotions and created a lot of tragedy that went along with this. In responding to the gun violence in the district, there are several violence prevention, intervention, and response programs that we know have been effective in the district. The District of Columbia is resource rich, but we are coordination poor. And so there's lots of efforts that are going on very separately and siloed. And so part of my role and responsibility is to collaborate and to lead the collaboration of the different models and different efforts that we have going across the city. We have a lot of people working in this space, a lot of committed, passionate people who are working towards it. And we need all of them to be. We know that there's power in numbers, and once we all can get coordinated, we will definitely and absolutely be more effective. We know that gun violence is a public health issue. We're using a public health approach to gun violence, which simply means that we're going to define and monitor the problem, identify the risk and protective factors, develop and test prevention strategies, and ensure widespread adoption of effective strategies. In DC, we analyzed 2020 crime data for violent offenses like homicides, robberies, and assaults where shots were fired and sounds of gunshots calls for service to 911. And what we found was that there were 151 blocks in 30 communities that accounted for 41% of all gunshot-related crimes. What we know in the district is that there are a very small number of people who are bringing a large level of violence to a very small number of communities. And so the idea is that if we can impact those communities positively, as well as impact those persons who clearly need services and supports and opportunities to turn their lives around and make better decisions, that is what we want to do. And so that is the sort of the crux of what building blocks, which is what we refer to the gun violence prevention effort in my office as Building Blocks DC. That is what we refer to, our strategy. So our strategy is for us to assist individuals who are most at risk of gun violence and providing them with the services and supports and opportunities that they need to succeed. We're engaging residents in co-creating solutions for communities most impacted by gun violence and creating the linkages to support communities, government, and nonprofit organizations. So we know that there are people who want to change their lives and make better decisions who are in despair. And so we are basically putting ourselves in a position to offer support and services. We know that Chief Conti and the police department are there to arrest and DOC is there to incarcerate persons who don't want to make better decisions, but we also want to be upfront to try to offer an alternative to people before they get there. Chief Conti and I share the philosophy that we know that as a city, we're not going to be able to arrest and incarcerate our way out of the gun violence problem. And so if we're able to invest in a population of people who were previously bringing harm to their communities and turning them into productive, law-abiding citizens, that we have clearly made a difference in our communities and in the District of Columbia. So what are our markers for success going to be? So outcome number one is that we want people and families most at risk of gun violence to be connected to support networks. And so once there is gun violence that happens in a community, there are those who need help immediately following. And so that's part of building blocks marker for success. We want to engage with communities and make improvements in areas that are prone to gun violence. And we want to have a whole of government approach to gun violence prevention, meaning that every agency in the District of Columbia, every government agency, the mayor is holding accountable for what are you doing to help to impact gun violence in the city. And for outcome number four, a whole community long-term strategy that coordinates all the resources available to address gun violence in the District of Columbia. So we refer to those that we help as people of promise. Since February, we've engaged with 78 persons of promise. We're actively supporting 29 and continuing to engage 34. What we know is that the individual needs of persons are very, very different. And so some people come and say, can you help me to get a license? And so what a very, very small thing to ask for. But if you don't have a license or a government issued ID, you're at a standstill in terms of turning your life around. You're unable to get a job. You're unable to do so many things that require identification. And so part of Building Blocks' role is to remove barriers that people face in obtaining and accessing government services. And so, for example, with the ID, we'll stick with the ID example. There's some people who have never seen their birth certificate. And so there are things that, you know, as residents, we take for granted that people have a copy of their birth certificate or their family may have a copy of their birth certificate. You have to prove your identity in order to get a state issued ID. And so what we're doing is working with those persons on an individual basis to try to help them to navigate through the city's services in a streamlined and expedited way to help them to get on a path of positive and productive engagement. We have initial interventions with victims at point of entry and care with trauma teams at several hospitals across the city, but George Washington is a biggie. So in other words, this is a model that's used across the country called hospital-based violence intervention. And so once a person has become a victim of gun violence, very often it is an opportunity while they're in the hospital to sort of rethink some things, the way their lifestyle that they may have been living. And it is an opportunity to offer some services and supports that they may be more willing to accept while they're actually in the hospital. And this is an evidence-based model that has proven successful across the country. And we have been able to offer employment to more than 120 people through government and business partners. Building Blocks is targeting residents between 16 and 35 years of age. And that's important because that's what our statistics show, that those persons who are doing shooting are between 16 and 35 years of age, who are high risk for future gun violence or victimization by meeting at least one of the following conditions. They have already been a victim of violent crime. They've been previously incarcerated on a prior gun charge. They're an active member of a community group or crew, or they're known to carry a gun or actively instigating violence on social media. So we have care coordinators and building blocks who learn about the behaviors and needs of the focused people and work with the district agencies and community stakeholders to sort of navigate the district government, the nonprofit partners to match up with services for those who are ready to make a change. We're also supporting, I did this one, sorry. Oh, I'm going the wrong way. My apologies. We are addressing public safety and infrastructure issues in locations that are prone to gun violence. So we go into communities and complete environmental assessments. That means that we go into the community, we walk the block. We have the 151 blocks who have been identified as the most violent blocks in the city. And we walk the blocks and the surrounding blocks and community and really look at what are the things that are going on in that community from an infrastructure standpoint that are impacting public safety. And we talk to the residents who are the ones who know best where there are areas of concern that should they be addressed, they believe that crime will decline in their community. I can give a perfect example of on Good Hope Road. There is an area that is not very well lit. And there's a lot of loitering right in that exact same block. Over the last 45 days, we've had 3 shootings in that exact area. And so we worked with Building Blocks, worked with DDOT, the Department of Transportation, to move in quickly, prune back all of the trees that are on that particular block and added lighting to really brighten up that space. And so the residents in the community are very grateful. It's less likely to be as attractive as it was to those who were known to be having illegal activity going on under the darkness of night. So far, we've engaged, we've identified over 50 community assets. When we go into the communities, we identify the different assets in the communities, the nonprofits, the small organizations, the churches, those places in the community that are community assets. And we also engage with community keys, which are basically formal and informal community leaders who kind of know everybody in the community. They know the dynamics of the community, and they're willing to work with us. And we work with them in helping to figure out what works best and how can they partner with the government to co-create public safety in their communities. We work very closely with the Office of the Attorney General, and Attorney General Racine's office is where we take nuisance properties that are in these communities hardest hit by gun violence and ask them to move through the nuisance property process to help turn, an abandoned laundromat that often turns into a sore spot. It's an eyesore. It's a place where people hang out, and turn it into something positive. So far, we've identified more than 200 observations and requests with community stakeholders, and we've been able to resolve 75% of them. We have some that are still in the works. These are the completed communities that we have been in so far. And I know that this group is from all over, and so this may not be as resonate as well with some folks, but these are the communities that have historically been underserved for generations. And so these are the communities that now are the same ones that are identified as having concentrated areas of poverty, concentrated areas of gun violence, and many other social ills. And so we have worked to complete the environmental assessments in these communities, and we have ongoing environmental assessments in the others. Neighborhood action plans are underway in these communities. And just to quickly tell you about a neighborhood action plan, when we go into a community, we ask the community to set up a date with us where we can do a neighborhood action plan. So communities know what they need best. Every community has its own culture and its own informal and formal leaders. And we ask them to meet with us to develop a neighborhood action plan that empowers the community to how they are going to improve their community. They talk amongst each other, hold each other accountable, but also they tell us as the government how we can best support their efforts. The neighborhood action planning allows the neighbors and the residents to feel empowered that they are responsible, as well as the government, in ensuring that their communities are healthy. So the whole of government approach I've already talked about, but we basically have identified the different agencies in the district, the most common ones that we need services from to help this population of people who need it most, which is the Department of Motor Vehicles, the Chief Financial Officer, Healthcare Finance, Department of Employment Services, the Office of Neighborhood Safety and Engagement, the Department of Human Services, and the DC Health Department. We've created 9 journey maps, which basically a journey map is a map of a resident's experience in trying to access government services. So for those of you all in the district, you know, we hate to go to the DMV. We all hate to do it. And it can be a hassle, but it's really a hassle in a whole nother kind of way if you don't have your documents that you need and you need support in navigating that. And that's the role of what we're doing. We also have promise rides for persons. We are working with some people who can't move safely throughout the city on public transportation. And while we work through that with them, they're able to access a service provider it's called VIA, but it's like a Lyft or Uber ride that we're able to approve for someone who may be going for a job interview or to a job training course. So overall, we're trying to create a long-term strategy to coordinate all the resources available in the district so that we can have one single plan for the District of Columbia that brings together the wealth of resources that we have and focus them on one issue. And so right now we are engaging with the National Institute for Criminal Justice Reform to build this, for the city to build a comprehensive citywide gun violence prevention plan. And it's something that we should have had a long time ago, and really looking forward to us developing it and creating a roadmap for all of us on how we're going to prevent gun violence now, but moving into the future as well.
Yeah, my head's kind of spinning because there's so much great information here. I was wondering, you didn't mention how you can help residents who have information about crime but are afraid to divulge, feel safe about reaching out or knowing where to go, or, you know, I seems to think that seems to be a problem in the city. You know, people know, but they can't tell.
No, absolutely. And I'm glad that you asked that question. So, you know, MPD has an anonymous tip line, but the community really doesn't feel like anything is anonymous, right? And so what we have in Building Blocks, and there's several other organizations as well, we have violence interrupters, credible messengers, who are persons who actually come from the communities that we're serving, who know those who are in the community, and they are trusted, incredible persons that the community feels safe talking to them, and then they can serve as a liaison with law enforcement to share. And even from them, we have a liaison to law enforcement, okay, that we get the information to MPD to help to stay focused on the crime and not be as focused on where the information came from.
Okay, the other question I have quickly is promoting this to the residents at large. Everyone who lives in the district needs to know that this plan is substantial, it's inclusive, it's just really incredible. I'm very impressed and I'm so glad to know about it, but I didn't have any idea before.
Yeah, no, I think I think for me, we've been building for the last few months, and so it is time for us to get the message out. And I went to a community meeting last night, and we have a lot of wins that we've done in this particular community, and they weren't even aware. They knew the things were going on, but didn't even know that Building Blocks was there. And so we have money set aside for a public information campaign, and so you should be hearing more about that soon.
So impressed. Thank you so much.
Yes, as you were speaking, I was doing a little research online, and I saw in a recent year there were 10 gun deaths in a whole year in Japan, and about 100 in the United Kingdom, and 141 in DC alone, and over 38,000 in the whole United States. And apparently DC has the highest rate when it's ranked with the 50 states. So the whole problem is there are too many guns and not enough controls. And so people pound the table and talk about the Second Amendment. Well, that became part of the Constitution in 1791 when there was no standing army and no municipal police force, and law and order was kept by village militias that were well regulated. Constitution has been changed 27 times, most recently in 1992. And we've had examples like prohibition where it was changed, and then repeal of prohibition where it was changed back. So I argue, when are the 60 or 70 or 80% of Americans who are against the Second Amendment, or when are they going to rise up and say it's time to change the Constitution? And does your outfit have any input into that process?
Ooh, no, that's not my lane. But I will say that because of the way that the district is situated, the looser laws that are in Maryland and Virginia really impact the way that guns flow into the district. But what I will also say is that what I'm very struck with is that the guns that we have that are coming in are weapons of mass destruction. It is, they are war level of weapons that bring about a lot of damage. And there's no reason that anybody, even a hunter, should ever need such, this is my personal opinion, need such a level of warfare. I'm not sure what the solution is, but I sure do hope that we can make some progress on that. And, the gun lobby has a lot of power in this country, and we really have to address that.
Well, just a closing comment related to your presentation today, Linda. We're starting a peace working group, and that's very broad. Peace building and conflict resolution is part of the DNA of Rotary. And in order to kind of integrate our work and initiatives as a club more actively, we're creating this peace, which is a nice short term. And we all want peace in our own neighborhoods. Of course, we want peace in the world. So we're working at both levels. That's their intention. So conflict resolution is a key thing. And interestingly, the director of Rotary International for our part of the globe, Peter Kyle, has started something called Peace and Youth in Action. So I'd like to keep in touch with you as an advisor, because we will be working with youth. We have what are called interact clubs at high schools. So this is one place, but it would be great to have you as a resource, if I may say.
No, I would welcome that. And working with young people is my passion. And restorative justice is something I've been working in for a very long time, and believe that the more that we can help when there is harm done, that we can come together and use restorative justice practices and principles. I think that it can help us from having incidents escalate to levels of gun violence. And conflict resolution arms young people with tools other than gun violence to manage conflict. And we have to make sure that our young people are armed. Not armed is probably in the right word, but that make sure that our young people are equipped with conflict resolution skills.
We have a tradition of honoring each speaker with the planting of a tree in partnership with the National Park Service. either
Oh,
on the
wow.
tidal basin or on the mall. We plant 45 trees. These are not just little saplings, they're substantial trees. And you will be invited to the next tree planting ceremony, probably next month, if we can. In any case, our club administrator will put in the mail to you a tree certificate. Normally, if we were in person, I would hand it to you. I can't do that. So thank you again for speaking to us, and we will be in touch.
No, thank you so much. And thank you, Mr. Barnes, for inviting me. I certainly appreciate it. He's been a trailblazer in the space of, in the space that I work in for many, many, many years.